the 9th of April. This is also one of the 3 days on which we ask the citizens to carry out the rapid test. This is the second day of the 3-day period. I have done my test. I believe Alfred has also carried out his test. I would like to appeal to the citizens to continue to support the effort. I believe that at the 4:30 press conference today, the Center for Health Protection will give you an account that is in relation to the use of rapid antigen tests. The number of self-reported cases. My understanding is that when compared with the day before, the number of declarations will be higher, but then it isn't an exponential growth. I believe this is within our capability and capacity to cope with, both in terms of providing support to home isolation or sending the infected persons to the isolation facilities. Today, I will talk about the deployment of technology. This is because a few days ago, we have told you that in the year 2022, we have the Geneva Innovation Awards. In recent years, we have been given awards for a number of years. But in fact, had it not been for the pandemic, we would have hosted a celebration ceremony to congratulate the award-winning individuals and organizations, but we can't do it this time. For the 2022 Geneva competition, well, we have got a few awards, and quite a lot of them are related to our fight against the virus. So today we're showcasing some products, and Alfred will brief you on that. My understanding is that at least 17 awards are related to our fight against the virus. 4 are given gold awards. Among them, we have a very familiar product, that is the sewage surveillance device. In fact, they have developed a new device so as to facilitate the surveillance of our sewage in our sewerage system in Hong Kong, so as to monitor the spread of the virus. In fact, every day we base a large part of our work on the outcome of the sewage surveillance scheme. For us to achieve such a performance, I don't think it is a matter of luck. For the past 2 years, we have been extensively using technology to fight the virus. There have been a few factors behind this. First of all, the SAR government has been rendering huge support to the development of innovation technology. I would like to comment on a few points. First of all, policy drive. Well, since the beginning of this term of the government, we have a high-level steering committee to promote innovation technology. Under the personal chairmanship of the chief executive, $130 billion or more have been spent on innovation technology. We are glad to see that universities and R&D organizations have been very enthusiastic. We have also got a large number of innovation technology startups. And as a result, we have a booming ecology. And of course, the deployment of I&T as well as the commercialization of the products, we need capital. We have seen a change to the listing rules of the Hong Kong Exchange. Many venture capital is willing to spend money on our local R&D products. As a result of those factors, we are glad to see that for the 14th five-year plan announced by the national government, for the first time, we have been told that the national government will support Hong Kong's development into an innovation and technology hub, in particular, making good use of the synergy between Hong Kong and the GBA. Here, I would like to pause, and then I will defer to Alfred to give you a more detailed explanation. Friends of the media, citizens of Hong Kong, I would like to greet you with a good morning. I would like to tell you more about our work against the virus. This is important. Technology at different levels can enhance our efficiency and effectiveness, and we can contribute to our fight against the virus. We have the Live Home Safe app with more than 7.8 downloads, and we have got the Hong Kong Health Code with more than 800,000 registrations. For the past 2 years, government departments, universities, R&D organizations and startups, we have been using different kinds of technologies to support the fight against the virus. Well, for the 2022 International Exhibition of Inventions of Geneva, Hong Kong got 204 awards. This is a record. And among some of the awards, as the chief executive has said, quite a lot of them are related to our fight against the virus, including the sewage surveillance scheme developed by the Hong Kong U. This is a world first, and we are able to look at the spread or the transmission of the virus. It has been extensively deployed throughout Hong Kong. So far, we have collected over 10,000 samples for analysis. Since the fifth wave of the infection, we have the sewage surveillance scheme, and we were able to identify more than 26,000 preliminary positive cases. The EMSD, the Hong Kong Hospital Authority, have developed the mobile HEPA units, and it has been given the Gold Award at the Geneva exhibition. In this way, we can use such filters to turn general wards into isolation wards. They have been deployed in over 400 premises, and in fact, we are showcasing this at this press conference. They have been used in more than 16 hospitals. And then we have the Logistics and Supply Chains Multi-Tech R&D Center, LCSM. At the beginning of the epidemic, within a short period of time, together with OGO as well as the Hong Kong UST, they developed an app as well as the electronic risk, and they have also developed a storage system. They make use that the delivery system is also highly effective. And then for the NAMI, Nano and Advanced Institute, they have also developed a new fabric so that it can kill the virus, and it highly raised our ability to fight the virus. And then we have also got an R&D center on automobile applications, and it can allow us to achieve zero emission. I think in order for us to fight the COVID-19 infection, the Innovation and Technology Commission has also developed a new product so as to enable the private sector to develop more technologies. One being what has been deployed on public buses, elevators, as well as homes for the aged. It is a coating, an antivirus coating, and in fact it has been advanced, it has been upgraded, and it can last for 5 years, and it can kill more than 99.99% of the infectious virus, including Omicron variants. So this is the coating. After applying the coating developed by the Hong Kong UST, for 5 years, you don't need to reapply any other antivirus coating. And in fact, more than 99.99% of the virus can be killed, including Omicron variants. And I would like to show you the robot. This robot is home invented, and it is to be used indoors for disinfection. It deploys 5G technique, and it has a 360-degree camera, and then it will apply the antivirus coating. This robot has been deployed at community isolation facilities as well as the promenades. In this way, we can enhance the public hygiene, and we can lower the risk of transmission. In fact, you can see that in the lifts, we have the no-touch lift buttons. In fact, it was given the highest level of award at last year's Geneva exhibition. So you can see that for the no-touch you know that it has been sort of installed or going to be installed in 680 lifts, covering public housing estates, government premises, as well as the Hong Kong airport. For the public cooperation scheme, more than $180 million would be involved in relation to the use of technologies. And in fact, we have got more than 300 partners here, and we encourage government departments to deploy technology to fight the virus. Together with the efforts of our partners, within a short period of time, we were able to develop an interactive dashboard map. So far, we have already recorded over 70 million visits. Not too long ago, we have also got an online platform so as to put together all the information that is useful for the fight against the virus, and that's for the ease of reference by the citizens. As the SIT, I'm glad to have this opportunity, and I'm proud to showcase you the many examples. But then they are just a minority of the many applications that we have. All the products that have been developed have the support of the government, like funding or participation of public organizations, provision of venues and scenarios by the government for testing the products. In fact, over the years, the Hong Kong government has been rendering huge support to the development of the innovation technology. As the CA has said, just for this term of the government, more than $130 million have been given to the sector for the development. From the examples that I've cited, you can see that our R&D outcome is good, and it has been given international recognition. Again, it has made huge contribution to our fight against the virus. I firmly believe that with the cooperation of the community, we can overcome the crisis, and we can fight the virus, and we can leave behind the epidemic.
The floor is now open to questions. Please put up your hand when it's your turn. Tell us your media outlet before putting your questions. Let's start with the journalist in blue at the front.
Two questions from the sub-China. The first question is concerning the voluntary RAT test. We'd like to ask the government about the statistics. How many infection cases yesterday does the government believe originate from the voluntary RAT test yesterday? And also, we are also aware of some cases of people who haven't done the test yet, especially some elderly and those living in the subdivided flats. So what are the remedies for the government to help these people to do the test? We are also aware of cases of some people living in hotels as serviced apartments do not get the service bags to do the voluntary RAT test. So what are the ranges for the government to help provide these people with RAT test kits? And the second question is about vaccination rate. As we are aware that the vaccination rate for children remains low. So what are the measures will the government take to boost this vaccination rate? And how will the government encourage parents who are still hesitant to let their children be vaccinated get the vaccines? Thank you.
Thank you for the two questions. We have started a 3-day daily RAT, that's rapid antigen test, yesterday. And I have made repeated appeals that every member of Hong Kong community should participate in taking the RAT for the very good objectives of helping the government to have a better picture. It's like a snapshot of the overall infection situation in Hong Kong, which I'm sure will be beneficial to our formulating the next stage of anti-COVID-19 policies. The second objective is a very tangible one because particularly for the Omicron variant, a very large percentage of the infected persons do not have symptoms. So they may not know that they have been infected. So if they don't know that they have been infected and they went around the community or have very close contacts with the family members, this would sort of help the virus to spread. So we have made this a very strong urge that for either one of the objectives, people of Hong Kong should take an active part in the RAT exercise. In order to make sure that people will easily and readily participate, the government has done a lot of things to make sure that everyone will have a good supply of the RAT kits. So we spent a week to pack all these 3.5 million anti-epidemic service bags. We spent a few days to visit the households in order to distribute the bags. According to my latest data, we have already distributed 3.1 million bags to 2.7 million households in Hong Kong. But we all know that sometimes the people will not be at home, and they may miss our distributing team. So we set up throughout the territory 89 supplies stations in order to enable the households, individuals, to collect their service bag, and also for those who just want to walk in and collect more RAT kits. This 89 stations started to operate on the 7th of April, and according to my data, we have already distributed an additional 92,000 service bags and an additional 270,000 RAT kits. So these are all the work that we have done in order to encourage people to take part. But at the end of the day, this is voluntary. So we cannot guarantee how many will participate. Actually, by now, you should know that even if it is mandatory, just like the restriction testing declaration that we are still doing every day in individual buildings, there are still non-compliance cases ranging from 1% to 3%. So this is the Hong Kong society. People treasure a lot their freedom to do one thing or to do another thing. But the government will never give up. We will continue to encourage, to persuade, and make it easy for people to participate. That's why at the very beginning, we already said that for those who are unable to read the instructions in English, we have APIs, 1-minute videos. We show at the various housing estates how to do this RAT test. So these are the work that we have been doing. And for people who live in hotels or service apartments, or they are more than welcome to walk in any of the 89 stations to collect either a service bag or additional RAT kits to enable them to participate. Now, you asked about statistics. I do not have the exact figures in hand, except that I was told that by midnight yesterday, the number of self-declared positive cases based on the Center for Health Protection self-declaration online system was a figure higher than the preceding day. Because if you look at the figures over the last 2 weeks, whether it is the PCR test positive or RAT test positive, the two figures are coming down. So in the last few days or so, the two sources of positive cases put together would give a figure about 2,000 to 3,000 every day. So if we have not done this or encouraged people to do this daily RAT test, one would expect the figures to continue to trend down, whether it is for the PCR or the RAT. But I'm now telling you that for this afternoon's announcement, as far as the RAT positive cases are concerned, it will be a figure higher than the preceding day. So that sort of illustrates that the daily RAT exercise does have its impact in identifying infected cases whom have not been identified because these people without symptoms, they will not go forward to do a PCR or a RAT test. But since you asked about statistics, I may as well elaborate on a figure that appeared in many of the newspapers' headlines this morning, that the figure of 30,000 that I mentioned yesterday. Now, this is a projection based on a study done by the Hong Kong University School of Public Health, what they call a point prevalence surveillance study. In other words, through a sample of 10,000 Hong Kong people and requiring them periodically to do the RAT test and report the result, that is the positive result, so that they can put together and give us a point prevalence. In Chinese, I think is 4點患病率. At that point in time, what is the infection rate in Hong Kong? So people who were tested positive in this exercise would be people who have been infected and self-declared to the Center for Health Protection, but they have not recovered. So if you put them through a RAT test, if their CT value is still quite low, that is the viral load is still quite high, they will give them the 2 lines. So they are still a positive case. The other part will be those, as I mentioned, they are asymptomatic, but having taken this RAT test, they discovered that they were positive. Now, the 30,000 figure was projected or estimated from the point prevalence percentage on the 6th of April, which was 0.56. So by applying this 0.56 percentage to the overall population of Hong Kong, that is 7.4 million people, and then assuming that about 1/4 of those will be infected, not yet recovered, the 3/4 will be freshly infected, then derive the figure about 30,000. You could do your own calculation. But I'm telling you that the latest point prevalence percentage on the Hong Kong U School of Public Health website, that is on the 7th of April, that percentage has dramatically fallen to 0.26, I think, is 0.26. So immediately, the projected figure of 30,000 yesterday would become 14,000 today. Okay? I hope you follow my calculations. And the 14,000, if we take the 1/4 and the 3/4, will give you what? About less than 10,000 infected but not yet declared. And there is also one thing that I discovered yesterday, that this 3/4 and 1/4 may not be very accurate, because in Hong Kong, every day we still have 2,000 to 3,000 newly infected and confirmed cases. So assuming that these people will take at least maybe 4 or 5 days to recover, then I would imagine at any point in time, if you take a snapshot of the 7.4 million population, there will be 6,000, 7,000 people who were infected but not yet recovered. And putting the 6,000, 7,000 to the 14,000 I mentioned, it's not 1/4, it's almost half. So taking all these factors into consideration, one would not expect the daily RAT test to review a very high number of newly confirmed cases. So I want to give you this background because later this afternoon, you might receive a figure which is not very high, but actually we should be very happy with a figure which is not very high as a result of a daily RAT test, which means that the government will have plenty of capacity to take care of these newly infected cases, either in transporting them to the CIF, the Community Isolation Facility, or through ITB to distribute the service bags to them and arrange online medical consultation and so on. About your second question on vaccination, we are actually disappointed that it has reached a sort of level which is moving upwards very, very slowly, particularly amongst the children. I think population aged 3 to 11 with the first dose, as at 8 p.m. yesterday, was 62%. So a week ago, it was already 60. So this slow progress in children taking the vaccine is very worrying, because the schools are about to resume face-to-face learning after the Easter holiday. I think yesterday, together with the Secretary for Civil Service and the Secretary for Food and Health, we have already elaborated on the many support measures that we have rolled out in order to promote and encourage vaccination. Particularly for children, we have special centers for children to take the jab. If you have visited one, just as I have done, which is in the Gleneagles Hospital, they have made the environment so pleasant. There's a lot of cartoons here and there so that children need not worry about taking the jab. But at the end of the day, this is for the parents. So again, I appeal to parents who have young children that they should arrange for their vaccination as early as possible. My experts, particularly Professor Lau Yulong and Professor Ivan Hong, because these two are clinicians. One is internal medicine, the other is pediatrics. So they looked after cases of infection, especially Professor Lau looks after children. So we have to trust him that although some said that the Omicron variant is mild, it could hit the child very, very seriously without vaccination. So I hope that we will all encourage and promote and urge the parents to get their kids vaccinated as early as possible. Thank you.
好，下一位記者提問。
Let's get a question from the next reporter. The reporter with a blue mask in the back. Good morning. I'm from TVB. Just now, the chief executive has said that the number of positive cases will be higher than yesterday. So the infection may worsen. Are you still going ahead with the resumption of classes? Do you have a target in mind? That is, at which level would you sort of refrain from relaxing the measures? Well, does it mean that with a higher number of declarations, many people are doing the rapid test? And does it mean that it helps to identify the asymptomatic patients? Well, for the actual figures, they're being sort of sorted out by the Center for Health Protection. I'm just giving you some advance notice. That is on the day, that is the 8th of April, the first day of encouraging the citizens to carry out rapid tests has been proved to be effective. Without the tests, the general trend is that, be it for the PCR test or the rapid test, the number of positive cases should come down. We have observed the trending for 2 weeks. Yes, the pace of lowering the level is slow, but then it is still a continuously downward trend. Today, in the afternoon, I believe that there will still be a downward trend for the PCR test cases. But then for the cases arising from the rapid tests, it will go up. However, the rate of increase will not be as it has been expected. There is a surge to the tune of 10,000-20,000 cases. Earlier on, you said that you were worried and you asked me whether we were able to cope. My understanding that this is not the case. Had it been the case, I think the alarming bell would have been activated. But then that isn't the case. In other words, it is entirely within our capacity to deal with the additional number of declarations of positive cases. We have got such a large-scale rapid tests. And given the initial outcome, I would say that this is a piece of good news. In other words, within the community, we don't actually have that many silent transmission routes. And this is in line with the signals arising from our surveillance programs, both in terms of the sewage surveillance programs as well as the restriction and declaration notices, or the voluntary testing carried out by the citizens going to the community centers. All the figures are coming down, and then, in fact, the rate is only 1 to 2%. So on the 8th of April, you don't see many positive cases being identified from the massive rapid test. Don't be disappointed. In fact, it's a piece of good news. I welcome it. So I would say that the increase is a slow increase. And if this is to continue, I am confident that after the Easter holiday, we can do what we have announced, that is changes to the measures starting from the 21st of April. I referred to them on the 21st of March. At that time, I said that over 3 phases, over 3 months, we are going to relax most of the measures, and schools can gradually resume face-to-face classes after the Easter holiday. I believe that for this approach to deal with the virus is scientific, and it's much better than counting on a single factor, that is a single figure. That is the level of cases that we have to reach before we relax the measures. We need to consider a host of factors. If we continue to suspend classes, it will do harm to the school children. However, there is a figure that I want to raise. I've been giving such daily press conferences for as long as a month. Now, if the number of cases come down to a 3-digit figure, I intend to put an end to this daily press conference arrangement. I'm happy to meet with you every day, but if there isn't much to ask about, you may also get tired. I really hope that I can disappear from this sort of scenario as soon as possible, because that symbolizes that we can control the virus infection, and then the number of cases have fallen to a 3-digit figure. All right, let's move on to another reporter. To my right, the reporter in the front in blue. I'm from Hong Kong 01. Good morning. For the hospital at Lok Ma Chau, it is said that Hong Kong Hospital Authority members went there, but then he was refused, and he was asked to show a green Hong Kong health code. Please elaborate. Now, the infection has been sort of easing. Are you still going to use the temporary hospital at Lok Ma Chau? And what about our isolation facilities, like the cabin hospitals as well as the isolation facilities all over the place? Are you going to scale down the efforts? Otherwise, it seems that the facilities are being all left idle. I must take this opportunity to express our gratitude towards the Central People's Government, the Guangdong provincial government, as well as the Shenzhen municipality government, for the huge support and assistance that they have given to us. For the Lok Ma Chau hospital that you referred to, well, it is a sort of a contingency. It is an emergency arrangement. When our hospital authority facilities cannot cope with the current infection sort of scenario, we have to get additional help. Earlier on, manpower was tight, and therefore for this particular hospital, the construction, the fitting out, the devices, equipment, and operation, all of them will be provided by the mainland. When compared with the temporary hospital delivered to us on Lantau last year, that is the North Lantau Infection Control Center, the 2 cases are different. At that time, Hong Kong standards were adopted. Hong Kong personnel were deployed to build the hospital. In this case, the one at Lok Ma Chau, it is different, because all the time we have been saying that it will be built and operated with mainland assistance. We have yet to commence or commission it. Part of it has been delivered, but it is not yet ready for operation. I haven't visited the hospital myself. I'm not clear about the case that you referred to, that is someone being refused. But then hospital authority, the FHB, etc., all of them were represented and present at the interface meetings, because we have to be clear about the arrangements. And for hospital authority directors, I don't think they automatically have the right to just walk in and visit the facility. I think we have the emergency regulations ordinance being invoked to give us flexibility to expedite the construction and the completion of the hospital. For the second question, that is when it will be commissioned for use. I think it depends. In the light of the experience, in particular of the fifth wave, we need to be ready with the facilities. Just like in the case of the third wave, with mainland assistance, we were able to construct a 800-bed hospital on North Nantou. Last year, the epidemic eased, but we still kept it alive, and it was run by hospital authority staff. I think at one stage there were just dozens of patients. At that time, we didn't have a single local case. We only got imported cases. But then we are glad to have got it because we can put it to good use. And then for that hospital at Lok Ma Chau is for emergency, for contingency. There was a misunderstanding, that is, by having to build this hospital, Alfred's Hong Kong Shenzhen technology park will be affected. This is a misunderstanding. The hospital is in the eastern part, but then for our technology park is in the western portion, closer to Lok Ma Chau, so not affected at all. All the buildings, all the superstructure facilities are not affected. Now, with the infection under control, the number of cases that are found positive will come down. Fewer people will have to be sent to the community isolation facilities. So what will happen to such CIFs? Currently, for such CIFs, community isolation facilities, there are a few categories. First of all, we have got 6 sites, and facilities were built with mainland assistance, Tam Mei Yuen Yuen Long, Ching Yi, etc. Altogether, we have got 5,000 units, 20,000 beds. The second category includes Penny's Bay, as well as the Lei Yuen Moon Recreation Camp. And then for the third category, earlier on we did rent certain hotel rooms. And fourthly, we have also taken over 2 housing estates. And we have also taken over interim housing facilities. So altogether, 4 main categories. For the Penny's Bay, in order to help the DSE candidates, we have already vacated the Penny's Bay facility, so that when we start the DSE, if we have candidates who are infected and who are close contacts of infected persons, then they can go to the Penny's Bay and use it as a special examination venue. We don't know how many candidates will have to go there, but then most of it, or the Penny's Bay itself, will be exclusively for DSE candidates. For hotels, gradually we are sort of withdrawing from the hotel rooms, because since the 1st of April, more Hong Kong residents are coming back with the lifting of the ban on flights from 9 countries. So we hope that the hotel rooms will be made available as quarantine hotels. And then for others, they have been converted into facilities for hospital authority staff members or staff members from the homes for the aged, if the staff members don't want to go home after work. So it's a matter of closed-loop management for them. And then for the 2 housing estate blocks, as well as the interim housing, altogether we have a capacity of 6,000 units. I'm talking to the Secretary for Trust Fund Housing. With the infection gradually being under control, and in particular, after we have got the outcome of the 3-day community rapid test exercise. If we don't identify a huge number of infected persons, we have to return the housing facilities as early as possible to those who are on the waiting list. Because we're talking about people who have been on the waiting list for a long time, people who are living in inadequate housing conditions. So we're not going to take over such housing resources on a long-term basis. So next week, after we have evaluated the outcome of the 3-day rapid test exercise and its impact on our community infection facilities, we'll see when we can return the housing resources as early as possible back to the Housing Bureau for allocation to the needy citizens.
Next question, journalist over here. I'm from cable TV. 4 questions. First, the Candidate Eligibility Review Committee has only 2 official members. You said that you would appoint another principal official to serve on the CERC. When would you make the nomination? The nomination for the chief executive election has started for a week, and John Lee has announced his intention to run, but the chair of the CERC is vacant. Would you have enough time to confirm the validity of nominations? Whoever is taking over the office of the Chief Executive Secretary, will this person also serve as the chair of the CERC? And the second question, the response to the mass self-test exercise. How will you assess the effectiveness of this mass self-test exercise? How many people do you expect to submit their positive results on the online platform? How many additional cases to be picked up would you see as a sign that the measure works? There are people trying to cash out their consumption vouchers online. Will the authorities crack down on this kind of situation? The 4th question, there are news reports that the Department of Health has amended the guidelines for visiting medical officers, or VMOs. When a VMO assesses that it is in the best interest of an elderly who is in a care facility to get a jab, then they will not need the consent of their guardians before administering the jab. So does that mean that care homes can administer doses to residents without announcing or without informing the family members when things go wrong, or who should be held accountable? Your 4 questions touch on 4 different matters. First, the Candidate Eligibility Review Committee, or CERC. As I said earlier, Mr. John Lee resigned as the Chief Secretary for Administration. Mr. Casper Choi also resigned as the Secretary for Home Affairs early on. The CERC now has just 2 official members left without a chairperson. I would appoint someone as the chair. The candidate will be someone appointed by the central authorities under Basic Law Article 48, Item 5. But I cannot announce the candidate now. Next week, I will make an announcement regarding the person who will serve as the chair of the CERC. The CERC does not have to be the Chief Secretary for Administration. There is no statutory requirement. The nomination period continues up to the 16th of April. By 23rd of April, we need to approve the validity of the nominations under the law. I am confident that the CERC can be formed by those dates and hold meetings to confirm the validity of CE nominations. The second question, the response to the self-test exercise. This 3-day mass self-test exercise is something that we hope people can take part in voluntarily with rapid antigen test kits. The objectives are clear. First, to give the government a better picture of the overall infection level in the city. Second, there are people who have been infected without symptoms. We want to help them know that they have been infected so that they can pay greater attention to personal hygiene, stop spreading the virus, and help the government provide the support they need in terms of home quarantine or treatment. Of course, the more people take part in the exercise, the better it will be, but this is a voluntary exercise. And for those who test negative, they do not have to report the negative results. So it's impossible to tell how many people take part in the exercise. And we will not go out of our way in trying to figure out how many people have done the test. I know there are media attempts to use various means, phone calls, etc., to check how many people have done the test, but those are not perfectly scientific ways to do it. Even if you do get the answer, it's not meaningful. We just want to get more people to participate in the exercise. The more people who take part in the exercise, the better snapshot we will get. After all, this is about getting a snapshot. We would have a more complete picture if more people take part in the exercise. And the asymptomatic carriers will be identified if more people take part in the exercise. Based on the figures I have, on the 8th of April, there are people who took part in exercise. People have 24 hours to submit their positive test results. This afternoon, there will be an announcement regarding valid declarations of positive results, but they may not fully reflect those who have done an RT test and tested positive on April 8th, because people have a 24-hour window to report their positive test results. But if there is an uptick that is bucking the downward trend in RT positive tests, that means we are picking up more cases through the RT testing exercise. So there is certainly an effect produced by this exercise. But to make it more effective, we will need more people to take part in the self-test exercise. Now, the third question, I am afraid I'm not in a perfect position to answer this question. After people get the consumption voucher, then they engage in some sort of activities online. Is that illegal? That's something you should check with the Financial Secretary's office. The fourth question, we have discussed this matter in our core task force. Vaccination rates among the elderly in care homes has been on the low side. But the fifth wave hit the elderly in care homes disproportionately hard. More than half of those seniors who passed away were care home residents. That's why, starting from last year, we have appealed to these facilities to get those elderly jabbed, but to little effect. We wanted to encourage vaccination to minimize the damage of a fresh wave of outbreak. But we will not give up, because a sixth wave may come, and there may even be a seventh wave. So we have no time to lose in trying to promote vaccination among residential care homes. As Mr. Patrick Nip said, 60% of elderly care home residents have been vaccinated. This month, our outreach team will make two rounds of visits to the elderly care homes to administer the second dose of COVID vaccine to those who are eligible, and also to those who couldn't get a jab because of previous infections, but it has been a while since the infection has happened. A tiny percentage, and I hope this is below 5% of the cases. Elderly care home residents couldn't get jabbed because objections from their family members, written objections, preventing the vaccination. But our core task force looked at this written objection. We also have to take into account what's the doctor's assessment, professional assessment about what's in the patient's best interest. Doctors save lives. They take this physician's oath. That is acting in the best interest of the patient. A doctor looks at a senior's condition in a care home, and if there is no medical reason against vaccination, then vaccination goes ahead. This is done so that when the senior gets infected in the future, the risk of a severe infection or death is lowered. This is a duty for doctors. If there is no legal guardian submitting a written objection, then we should attach greater weight to a doctor's assessment in vaccination matters. This is not a policy change. We're clarifying the matters so that the doctors know what to follow, instead of having inconsistent practices across different physicians, because that wouldn't be fair to doctors. So, in the guidelines issued by the Department of Health to visiting medical officers, that reflects the result of our discussions. Doctors treat patients every day. There are all kinds of risks. So there's no need to worry here. They're taking part in this government vaccination drive. Under CAP 599, there are guarantees for physicians. The government provides the vaccines. It's a government program. We shouldn't get hung up over liability issues. This is about protecting the elderly. We hope that the family members of seniors and care home operators welcome our outreach teams to administer jabs to eligible seniors. That's all the time we have for the press briefing today. That concludes the briefing today. The reporters, please get prepared. The chief executive will take a picture before get the equipment over there.